Hello, my name is Dr. Julia Smith, and I work in the Global Tobacco Control Research Program at Simon Fraser University in Canada. I'm going to share some very quick thoughts about why tobacco control is a model for addressing undue industry influence in public health. And the first is that if we look at the history of the tobacco control movement, we really see a lot of research has demonstrated that you can't trust industry-sponsored science. And so a lot of researchers around the world have documented the numerous instances where the tobacco companies have sponsored research either by academics or think tanks or have set up their own think tanks in order to produce research that contradicts public health science. And this research has, over the time, been disproven and demonstrated to be based on false premises. And I think this is really important to remember. The other thing that we learn from public health research is that we need to be critical of corporate social responsibility initiatives. So again, tobacco control history really demonstrates that the tobacco companies that engage in corporate social responsibility initiatives, such as prevention programs or sponsoring specific civil society groups, do so for their own interests, and their interests are based on selling a product that is deadly. And those goals are incongruent with public health goals, and you really cannot have a relationship between the two of them. And so tobacco control research has really demonstrated this need to be very critical of any corporate social responsibility initiatives, but particularly those that are promoted by health-harming industries. The Framework Convention on Tobacco Control has played a major role in monitoring these sort of relationships and also prohibiting relationships between public health agencies and the tobacco industry. So Article 5.3 within the FCTC is revolutionary in its commitments to maintain distance between the industry and public health or government. And I think this is really important, and while 5.3 has not been implemented fully and always effectively, it has set a norm and a process for engagement of civil society organizations and other watchdogs in order to prohibit industry influence in public health. It provides a tool for governments to refer back to when they're faced with questionable relationships. And I really don't think it should be underestimated as such. And the final lesson, which is related, is the importance of civil society in terms of monitoring corporate influence. And I think that civil society has played such a key role in promoting action around the FCTC, monitoring commitments under Article 5.3, that it really needs to be commended, and that the government really needs to take up the challenge and respond and provide either more support to civil society organizations that are doing that sort of work across different industries, or do that work better themselves. Thank you.